You're watching Let's Chat.
We are going to spend a few minutes with Dr. Anuj Chandra from the Advanced Center for Sleep Disorders. We're talking a lot about COVID. We're talking a lot about sleep and how the two of these are related. First of all, Dr. Chandra, thank you for joining us.
Absolutely, Chip. Thank you for doing this and bringing attention to this. Really important.
Tell us a little bit about the relationship between getting your COVID vaccine and making sure that you get enough sleep. I had no idea the two could be so closely related.
Yes, and there is lots of research to show that your immune response is going to be significantly better if you're well slept before and after. And we have this data for the flu vaccine, from the hepatitis A and B vaccine, that the body's immune response is much better because the immune system is also rested and ready to go, to put it in common parlance. So people who are getting the COVID vaccine, and lots of people are, we all know friends, neighbors, other church members, that you must tell them that the night before, just get a really good night's sleep, and also afterwards. In fact, I have been telling all our patients with the second dose, speak to your employer and try and take the day off, because after the second dose is when the immune system really revs up.
How does the stress get in the way of the vaccine's effectiveness?
So we do know, just like the rest of the body, the immune system, also the response, the interleukins, the cytokines, the antibodies which are produced. Sleep is essential for life. That's just the bottom line. And good sleep revs up your immune response to the vaccine. There's an innate immunity and there is a humoral, acquired immunity. So innate is what we already have. And that's why we know when we are stressed, we are, really deprived of sleep, we are more prone to getting COVID and other infections and the flu and the cold.
Right.
But, that we know for a while. Acquired immunity is when we take these vaccines, and that's what's giving us the acquired immunity to COVID. And so just to put it, in common parlance, it is the rest of the immune system is really important. It helps it rejuvenate and get activated and reactivated.
All right, let me ask you this. If you could tell someone exactly, specifically what to do step by step through shot 1 and through shot 2, if they're getting the 2 shots each, what would it be? Does it vary because of age, or is it everybody pretty much the same blanket instruction?
Right, same blanket instruction for everybody. At least 2 days before, make sure you're getting about 7 to 8 hours of sleep, get some exercise, avoid alcohol for sure, the 2 nights before the vaccine, because that disrupts sleep also. And, go for a long walk, just de-stress. And then that's up before your first dose. And then the second day after the vaccine, make sure you don't have a really busy day. You're not going out, partying, or even, drinking alcohol, because that will disrupt sleep, or a lot of caffeine. So, you could just, take it easy. Again, get a good night's sleep the day after the vaccine.
Go ahead. I'm sorry. No, after the second vaccine, what's the best thing to do? You said hopefully get the day off, right?
Absolutely. If you can, you should really get the day off. Most people will get some sort of symptoms, malaise, chills, about 7 hours or so after you've gotten the second dose.
Right.
And really just consider this as a good sign that the body is revving up the immunity. Now it's already prepared after the first dose, so it's ready to go. So don't get afraid. I mean, you can take Tylenol and you can, take ibuprofen, and you don't have to tough it out. But wait till your symptoms start. Just don't start taking Tylenol and ibuprofen right off the bat.
As always, good advice. We'll be talking to you here over the coming days, because this time next week we're going to be into daylight saving time, where everybody loses at least an hour of sleep on the front end. So Dr. Anuj Chandra, thank you so much. You want to find out more about Dr. Chandra, you can do so at the Advanced Center for Sleep Disorders. The Advanced Center for Sleep Disorders. Call them at 648-8008. Stay with us. We're back with more right after this.